Good evening and welcome. This is the third in our series of COVID-19 webinars, and we're delighted to have with us today Jenna Luché-Thayer, who may be familiar to you from the 2018 annual AONM conference where she gave the keynote speech. She's been working for over 35 years globally on the rights of the marginalized. She's the former senior advisor to the United Nations and the US government. She's the director of the Ad Hoc Committee for Health Equity in ICD-11 Borreliosis codes and the founder of the Global Network on Institutional Discrimination. The Ad Hoc Committee that she runs has succeeded in entering numerous human rights violations against Lyme borreliosis into the record with the United Nations, and presented these cases to the Special Rapporteur responsible for health, human rights, and these were actually entered into the UN record, successfully establishing new codes for life-threatening complications from Lyme disease. This was a major achievement for the global Lyme community because it's the first time in over 25 years that these serious complications have been officially recognized by the WHO. I'll hand over now to Jenna. Thank you very, very much. She's going to talk about what are the long-term human rights challenges around COVID-19. Thank you. Jenna, over to you. And we did think we would first discuss the connections between the Lyme disease pandemic that you've been involved in for so long and COVID-19. Would you say that people with Lyme disease and tick-borne infections are especially susceptible to this novel virus?
Well, as many of you know, I'm not a medical expert, but I have been doing some scientific reading on this. And one of the things that they have found is when they studied the MERS, Middle Eastern Respiratory Syndrome, was that the B cell part of the immune system did not react to the coronavirus again, and there were very few antibodies left following infection sometime later. However, there seemed to be some T cell memory of the MERS infection. Now, with Lyme disease, many of us have compromised T cells, and even further complication is, of course, that they're finding that the coronavirus actually attacks the T cells. So does that put us at more at risk? Possibly. But again, I'm not a medical expert. I think there's a lot of this immune aspect of the SARS, the COVID-19 that we do not yet understand, and how that will interact with people with our particular type of immune compromised systems, people who suffer from chronic Lyme with B cell mediation issues, lowered T cells, immune systems that are generally dysregulated, either overactive or underactive, and cycling back and forth through this. It's hard to know. However, I personally consider myself to be at greater risk because of having chronic Lyme for decades, undiagnosed and then eventually diagnosed. And I've had my immune system tested and checked, and I have immune issues. So I take every precaution to protect myself from this virus.
Okay, thank you. I understand. Do you think that people who have been suffering with Lyme disease for many years have any specific skills or strengths to cope with this pandemic?
Yes, I believe we do. I'm just go down. I was preparing my notes on this. So one of the things that most of us, and I'm not talking about the child who's born with Lyme, but I'm talking more or less about the adult or the young adult and the adult who's contracted Lyme, and the more chronic, serious form of it. Not those who were early diagnosed or early treated, but those of us who have lived with serious complications from long undiagnosed or undertreated or untreated forms of this illness. First of all, we've all experienced a great sense of loss and grief. Now we have a pandemic wherein people around the globe are also experiencing loss and grief. You know, these are things that every human has to learn to live with. And we have exercised those muscles, you know, how to survive loss and grief, loss of livelihood, loss of broad social networks, loss of our ability to engage fully the way we used to in our lives, the grief of losing our sense of identity, who we are, you know, that active parent or active child, or rather active brother, sister, family member, community member, as our health has been debilitated and many of us have been disabled. We've had to give up those notions and grieve the loss of that person and accept who we are, and then learn to love the new person that we are. So I think that this is something that across the globe people are experiencing with this pandemic. You know, not only those who are sick and developing very serious disability and debilitation from the coronavirus, but those who are just simply losing all their social networks, their livelihoods. You know, we've had this experience and we know we can survive it. And we can help other people to get through this by sharing that part of our experience with, you know, our friends who are facing this pandemic and who may not have had this kind of loss and grief before. So that's one thing.
That's
the other
very
thing
thank you. Yes, sorry, you were going to go on to something else?
Yes, and the other thing is that those of us who have, you know, lived with a very severe form of chronic Lyme and tick-borne disease, or a debilitating form of it that comes and goes, we have a new normal, and we have adjusted to a new normal. And our whole life really revolves around a new normal in order to survive and even thrive with these conditions. Now, again, we have a whole world around us that's trying to adjust and grasp a new normal. And those of us who have these illnesses, who embrace the fact that we have a new normal that we have to contend to, rather than denying the condition, are doing better. And I think, again, that's something, a lesson that we can share with our wider groups of friends in our community, that a new normal is survivable and, in fact, can be, you can have joy in a new normal. I think another thing that we have in our favor is that we have developed a vigilance for health and politics. We no longer accept anything that's basically said. We look at everything with a critical eye and critical thinking. This is because we have been medically marginalized. And we have, many of us understand now that there is corruption in the healthcare systems globally, that there are agendas that have nothing to do with health and well-being that are driving certain healthcare policies. And so we have a good critical eye in the way we understand information that comes out, whether it's about Lyme and tick-borne diseases or about the coronavirus. We are inquisitive, we are curious, and we do not accept everything at face value. I think that's something that is an important skill, important insight to share with people who may never have encountered medical marginalization or had a previously a bad experience with the medical system. Because now with the coronavirus pandemic, there are a lot of things going on that need to be questioned in terms of policies and practices, not only for the Lyme and tick-borne disease community, but for the larger global community. And our vigilance is also important, is that we have developed an awareness of our day-to-day health status. So we are very aware of our health status, and we know how to use our energy when we have it. We know when to step back and rest. We tend to be very disciplined in taking the supplements that we need to take in order to keep our immune system functioning and improve our health. We have learned to be very frugal with our finances, most of us, because we're making decisions all the time based on what will it cost me to take care of my health versus other things that may be options. So many of us have learned these skills the hard way, but these are very, very important skills. We have, because of all of these things, we're good at prioritizing and organizing our lives to prioritize health first. And then we, in many cases, many of us see money as having basically only the value of what it can give us for quality of life. We're not materialistic in that I want to buy this and I want to buy that. We really do see money as a resource to help us maintain a good quality of life for ourselves and for those we care about.
Thank you.
So between all of these things, you know, in many ways we are psychologically and managerially prepared for living through a pandemic. I mean, nobody wants to, but we actually have skills that we have honed in order to survive our Lyme experience and medical marginalization. So we have a great deal of tenacity and we have a great deal of resilience. And these are all things that we can share with others, you know, who are really struggling, maybe for the first time in their lives with such overwhelming challenges.
Thank you very much. Yes, what you mentioned there about marginalization is perhaps something that we could pick up on regarding some aspects in the UK that have been a little bit worrying. For example, there have been reports of patients having to sign do not resuscitate orders, perhaps because they have to go into hospital to be treated for a cancer. We heard of this related to a young child where the mother was asked to do this and had to take a lawyer to fight for his rights. Have you heard of anything of this kind against the backdrop of COVID-19 happening in other countries? It's not just age discrimination, is it? It's even affecting young people and seems to fly in the face of human rights in some cases.
Well, what's happened in the United States for a long time now, they always ask you to have a paper, you know, stating whether or not you want a DNR or do not want a DNR. I know that in many of the Scandinavian countries, as soon as you enter into hospital, they determine your care, whether or not you will be resuscitated. You waive your rights.
Is that just now, since the COVID-19 pandemic started?
I think that's been something that's been kind of creeping. Like if you go into, there are cases with Lyme patients who are, you know, getting more and more sick, and if they went into the hospital setting, then they basically waived their rights to resuscitation. So yeah. So that's been going, and I don't know that it's any person, but I do know from discussing this with some doctors in Scandinavia, particularly in Sweden, that many old people do not want to go to a hospital because they fear being not resuscitated. They'd rather be at home and try to maintain as much medical care as they can from their home, within their home, rather than going to a hospital setting. So that's kind of been a creeping issue. How do not resuscitate? It should be a personal choice, you know, if you want to be resuscitated or not. But certainly what's happening in France, they've taken it a step further with regards to COVID-19. What's happened is on March 26th, they restricted treatment for people with COVID-19 outside of hospitals. And then on March 28th, they basically instituted another policy saying that elderly people who are having respiratory distress should be given a pharmaceutical drug called Rivotril for the management of patients likely affected or likely to be infected. So you might not even have it, but you're having respiratory distress. And so the problem with this particular drug is that it does not provide any kind of comprehensive therapy for any type of pneumonia, but it can be used for a respiratory depressant, and it keeps the patient in a drug-induced sleep state or semi-sleep until they die. So it basically further suppresses the immune system. It's a form of euthanasia.
Oh no.
Yeah. And it's caused a great outcry among many frontline doctors, partly because in the past, if somebody was to administer this drug to somebody who they believe is going to be dying, you know, Well, first of all, they're not being given any option for treatment. They're just being given this drug. If they're elderly, they're called the fragile elderly. They're given this drug. But they're not, before it would have to have a couple doctors decide this, whether or not it would be the course of action. Now one doctor can decide it with no consultation, and they are under no requirement to tell the family that they're taking this course of action.
That is the case under the new coronavirus bill here in the UK as well.
I mean, it's a terrible, terrible thing. You know, for many reasons, but primarily the first one is that first decree where they deny access to early treatment. Everyone should be given early treatment, and then if there's a progression to, you know, a very serious, clear indication the person is dying, then and only then should certain things be considered, and certainly they should be asking for, you know, some consent. If not the person who's dying, who's maybe you know, unconscious, but family, a representative of some kind. It could be so easily, it just seems extremely unnecessary, given there appear to be a number of drugs that can reduce the viral load and prevent hospitalization and complications. I mean, we don't have all the answers on the treatment, but to basically just kind of go immediately to only palliative care and then, you know, inducing coma and semi-sleep until death is shocking.
Absolutely.
Yeah. And then I was going to say, so in Sweden, the situation there is basically that, you know, again, they're really not providing any treatment, and particularly for the elderly and the people in the nursing homes or older homes for older people. You know, they actually know that people to their right and left are dying, and they're just kind of waiting there. Imagine how terrifying that would be.
Absolutely.
And there's really been there's just information now just starting to come out about this. And not only that, the Swedish Public Health Agency advised to care workers and nurses looking after older people is that they should not wear protective masks.
Why is that?
They should not wear protective masks or use other protective equipment unless they have suspicion the person is infected. But of course, this is ridiculous because we know that people are asymptomatic. So they're basically, well, one of the nurses who was working in this condition said, the worst thing is that we, the staff, are taking this infection to the elderly. So, and then in the United States, of course, until very recently, you know, we were told not to wear masks. And this is a huge problem. It's not only a huge problem for the patients who may be exposing each, you know, the potential patient and transmission, but we were told our government policy was do not wear masks. Do not protect yourself. Do not protect others from a potentially fatal virus.
Was that in every state? Has it been the same throughout the states?
Yes, it was our government policy until very recently. And then they said, okay, wear masks, because if you're infected, you might prevent infecting others. And anyway, but this whole lack of PPE is a human rights issue. It's a major human rights issue.
Yeah. One aspect of human rights that people are also focusing on in this country is the increasing surveillance. What could be hidden beneath the term contact tracing that's being talked about every day now in the news, which has been hugely blanketed across China from all, you know, by all accounts. Is that anything that people are discussing in the States, or does there seem to be more of a general acceptance of that trend?
It's very interesting. I mean, the U.S. has much weaker laws than Europe does in general in terms of surveillance and misuse of personal data. You know, the EU in general, and the UK probably as when they're members of the EU, but perhaps now, I don't know what their individual laws are, but they have a lot of protection against misuse of personal data and access to personal, much stronger than anything that we had in the US, much stronger. People, here in the US, it's always about, money. It's like we're using the data to sell people things. That's why we're collecting data, is for, capitalist purposes, selling items to various people. However, there is very clearly an enshrined human right. Let me just go to that right here. Regarding the right to privacy and confidentiality is an enshrined human right. Now, so I read the articles in about the UK situation, and also in the US. They're talking about making data anonymous. In other words, they're going to collect data on people's moving around. But in the UK, they're talking about collecting a lot more data than that. And I'm sure this is happening also in the US. In fact, there have been a lot of issues about confidentiality of medical records and status being widely shared. There's data breaches all the time, but also once you get in and get certain types of data, oftentimes you can connect to other data sources that are related. So I think this is a big issue. Now, we have to balance this with the idea of protecting public health, which is also a human right. We all have a right to health. So, for example, there has to be some balance struck whereby people know that certain types of data is not being collected and shared, and maybe limiting this to the data on movement if you wish to do it. But again, it's a very tricky thing that we're in right now, because
it's a tricky thing to mandate it, isn't it, really? Yeah.
It's tricky. It can be done, but we have to look at the individual right as well as the collective right to health in this case. In other words, if somebody has been told to self-quarantine because they're infected, and that person decides not to follow the rules and just runs around infecting a bunch of people, now that person's breaching our rights to health. Yeah. So this is a little bit complicated. How are we going to sort it out? But the fact of the matter is if we're going to have certain practices to protect public health, they have to come with very clear guarantees on privacy and making sure certain things are kept anonymous, so that people can't be denied, for example, denied care and treatment if they have certain medical conditions.
Right.
It's a big issue. Yeah.
Moving on to something else, sorry. There's a little bit of a kind of time lag on the transmission at the moment. I believe there's an issue with the virus possibly lingering for days in sewage and water systems. Yeah. You've written about that, and people haven't over here in the UK heard much about that at all. Could you possibly let us know some further specifics about that and how it could affect water safety long term?
Yeah, well, what I've done is I've basically shared articles on these things. I have, tried to assemble information as it's come out and share it on social media. And one of the things about this virus is that coronaviruses can remain infectious for days and longer in sewage and drinking water. And drinking water, not just sewage. So this means that we have to kind of look at our standards for disinfection in sewage and water treatment. So this is going to be a cost issue. Are we going to have certain practices put in place to make sure that people are not being exposed to this particular coronavirus through water and sewage practices? And of course, poorer communities, rural communities, developing countries might not be able to afford, more stringent standards, or they might not be prioritized, or there might not be help. But what we have to understand in this particular case is every time there's an outbreak in another country, within a day, it can be in our country. If there's an outbreak in a poor rural area of the United States, within a day, it can be in a big urban area of the United States, because that's the nature of this virus. It moves wherever it wants. As long as you have 1 or 2 people infected, then they go anywhere, they're carrying it with us. So this is a major issue. Basically, you know, we have globalized trade and travel. So any place that has has sewage system, in a lot of sewage systems, what they do is they aerosolize the sewage to break it down.
Oh, really? Okay.
You know, and that's like, that could be a very, very dangerous process unless the whole thing is encapsulated. But I know, for example, from my personal experience in the United States and many countries, is you go to a sewage plant area and it's just an open pit being aerosolized.
Oh my goodness, I had no idea.
Yeah. Yeah, particularly in rural areas in the United States, it's cheaper. You know, there's a lot of land, so there's a big compound and they just have all this stuff and they're blowing it and helping it break down. So, and that happens a lot in developing countries too. And then of course, even more elementary where sewage is being untreated and going right into places where people are collecting water, right into the ocean. You know, we don't really know. So it's, this is a big issue. And then they're saying that, you know, there may be biofilms that form that they already are biofilms with coronaviruses, other ones. So these biofilms could then basically attach themselves to aging drinking water systems. So
Understand.
this is something that really, and this will be, this, it sounds like a major, it sounds like a simple infrastructure issue, but it becomes a human rights issue because, you know, there already are a lot of discrepancies in the quality of drinking water and sewage treatment based on all kinds of political and economic concerns.
Of course, yes. Well, there are laws being instituted across the world now that are emergency measures that are, I don't know, it reminds me a little bit of your 9/11 experience in the States with the Patriot Act and others, where once laws of this kind have been enacted, it may be difficult to backpedal and return to where one was before. There's already a lot of talk about new normal now here in the UK. Have you seen any examples of sort of almost Trojan horses being used to needlessly erode established protections, or do you think it's too early to tell yet whether this will be used in that way?
Let's just
I realize that's a big topic and it may be unfair to talk about that at this early stage.
It is, but let me just go to here. Let's see. So I looked at the UK articles that you sent me, and I you know, reviewed them and some of the things that are being discussed in the UK, as well as other places. What one EU official said is that the data will be deleted once the coronavirus crisis is over. Now that to me is concerning because it might not be over for a long, long time.
Exactly. Who determines that? Yeah.
Exactly. So yes, I mean, this is again, so some of the discussion going on in the EU, less so in the United States, I would say, is the transparency of the decision-making on how data will be collected and used. In other words, it can't just be done in some back room and then people don't know. There has to be very transparent process to discuss how data will be collected and used. You know, we know already that regardless of our own government's practices, we have criminal hacking going on with data. We have different countries are spying on each other's data systems. This is a well-known phenomenon. So we not only have to be concerned with our own government's transparency and accountability around data access and data use, but we have to be concerned with the larger global, interactions of all of these attempts to use and abuse data. And for those reasons, I think there needs to be the potential for human rights abuse regarding this is very large unless there is a strong political demand and pressure for transparency and accountability.
Right.
And that's, will that happen? Certainly, we see public policy discussions around that when the government and various governments ask the public to engage in policy discussions so that we can say we've had an open and transparent process and the public is basically coming into agreement with our way forward. Well, we already know that these systems, these so-called participatory policy procedures, have been very much, undermined by ill intentions in other cases. For example, the Lyme policy discussions. It's a joke. They're a joke. In Canada, in the United States, in the UK, they asked for public engagement, and then they didn't allow any number of things to be part of the topic of discussion.
What is, yeah.
I mean, you can say we're going to be transparent, but then you set up all these arbitrary rules that basically block any transparency.
Mm.
So, when you have that kind of practice in place, the public has to be very, okay, well, they've done it for Lyme disease. They've done it for myalgic encephalitis, chronic fatigue syndrome. They're doing it, in various places. What will they do for this particular disease?
Right.
Right.
One question which came in just before the interview today was, and I'll just ask it now because it seems to fit quite well. In your experience of human rights campaigning for Lyme disease, do you see any similarities with the COVID pandemic? I mean, obviously you've already gone through many of them, but is there anything you'd like to add?
Well, I mean, they share many potential human rights issues. What are these human rights that they share? The right to liberty and security of person that prohibits unauthorized disclosure of personal health data. Both of these epidemics are threatening this human right. The well-being of prisoners. This is one that's being, it's only recently come to the forefront in the United States because we're having such huge outbreaks in the prisons. But certain states are releasing non-violent prisoners to protect themselves and the larger community from coronavirus. Others aren't. There's no uniform response. The right to the highest attainable standard of health. Now we're getting into something very complex. The highest attainable standard of health for the patient may be something, but if the frontline workers, like the doctors and the nurses and all the other health professionals, aren't given PPE, their right to health is compromised. So, I mean, it's a scandal that we don't have PPE, personal protective equipment. It's a scandal.
The case in many places in the UK as well, many hospitals. Yeah.
Well, yeah, I mean, it's global. I mean, it's ridiculous. I mean, we have in our country, we have the Defense Production Act, where we could have manufactured all of this stuff months ago. Taiwan was able to do it. Within the first month of the announcement that there was this potential epidemic spreading, they produced over 40 million masks and thousands of intubators. 40 million masks.
Yeah.
And we're being told to, doctors in some hospitals being told to use 2 masks over a 2-month period.
Yeah.
I mean, a 1-month period. So, I mean, so here's another one that is shared in terms of a potential human rights issue. Of course, the right to freedom from inhumane and degrading treatment, torture and cruel. I think it's very cruel to euthanize somebody instead of offering them treatment.
Well, of course.
The basic right to life, the right to liberty and security of person. That again is like, if you go to a hospital, should you be able to leave? Should you be able to have a choice for do not resuscitate or do resuscitate? The right to information, I think this is a huge one. Even though we know that this is our knowledge of COVID-19 is evolving, we have also been given bad information.
Yeah, there's no discussion at all of the importance of strengthening the immune system, certainly here in the UK. No advice, even the advice to just stop smoking or vaping isn't being given.
Well, yeah.
And people aren't being told of any, like vitamin C, the most fundamental, nutritional advice that they could be given to protect themselves isn't being,
well, and also this whole thing where they kind of started out by saying, well, don't worry, if you're not old, you're going to be fine. You know what I mean? It's a very dehumanizing thing to try to like get a population to accept the fact that the old people are all going to die from this. That's a really horrible psychology to put forward. Don't worry.
Yeah.
You guys don't worry. It's just the old people are going to die. Well, now I know anybody can die from this. But they did the same. This was a policy, it reminded me immediately of the AIDS epidemic, when they told the general population, don't worry, if you're not a gay man, you're going to be fine. You know what I mean? So let's not worry about a very, small part of the population that, serve no useful purpose, right? I mean, that to me, it was like, it just smacked of that. And then of course we know AIDS does not ask if you're gay or straight, and neither does this virus. That to me was wrongful information. And they knew enough already, I think, from the Chinese data that I read, that was, in my opinion, information that was shared to minimize public panic. So that's anyway. So we talked about the right to public policy, participate in public policy. Oh, right to non-discrimination and equality. Yes, who among us will have the right to treatment? If you have Lyme disease, chronic Lyme, well, they basically say, oh, we're not going to treat you. If you have some other chronic illness, if you're elderly, are they going to triage the most feeble and vulnerable outside of healthcare as this continues? Because it looks like this will continue.
It's certainly happening in this country that people with other conditions are not getting treatment unless it's an absolute emergency.
Yeah. So then we come down to the right to universal health care. So if you have the national health system, which is supposed to provide universal care, already creating obviously discriminatory practices, that's a problem. But then in other countries, of course, in ours, you have to buy health care for the most part. And so people who can't afford private insurance or who've lost their jobs and no longer have a healthcare insurance policy, yes, they're saying that anybody can be treated, anybody can be tested, but will they in fact be given palliative care, or will they be given the same options for medical treatment and potentially, not curative, but helpful therapies and treatments to reduce their viral loads, to improve their health so they can survive it? I mean, these are all really big questions. Let's see, some of the other human rights issues that are related to this. Right to decent working conditions. Again, all the frontline workers, not only the hospital, not only the doctors and the nurses, but the people working in the grocery stores, the people who are delivering the packages. In our country, there's no requirement that they all wear masks. They're not provided them by their employers. They're not provided sanitation equipment.
Mm-hmm.
Some places are doing it, some employers are doing it, but there's no requirement. One huge scandal just the other day, in my opinion, is that the US, the CDC came out with guidelines for meatpacking plants.
Okay.
And so they came out with guidelines on how to make them safe for the employees. And then we have another federal agency called OSHA, which is Occupational Safety and Health. And they enforce that industries are providing adequate safety and health protections for their employees. Well, they worded this verbiage for health protection for these employees as suggestions, not requirements. And so OSHA, the federal agency responsible for occupational safety and health, does not have to enforce any of them. So now you have people who are tend to be in the lower paid jobs, like meat production, factory production, grocery store clerks, etc., saying, you know, I have to determine whether or not I'm going to take my low wage job and possibly put myself in harm's way, possibly get killed, possibly die doing a low wage job, possibly infect my family just trying to bring in some income. I mean, this to me is not a right to decent working conditions.
No.
Everyone should be provided adequate protection across the board. Right now in the United States, they say that we're losing one airline attendant a day to this virus because they're not being protected. I don't know about all the other countries, but I do know that, you know, these are people who are not being given decent working conditions. They're being, and it's so cruel, it's so indecent that the CDC and OSHA have come out with this ridiculous garbage suggestions instead of requirements for frontline workers. They're demanding that these meat plants stay open when they're not providing them any required protections.
Yeah, have to look into what's happening here on that. Could I ask you a few questions, because a lot have come in? In fact, the first one here is more of a statement, but it does link up to what we were just discussing relating to not giving any advice on strengthening your immune system.
Yes.
This attendee says that it's just a statement, but it's a very important one, that hormone levels, IgG levels, all appear to be a great factor in the body's response to infection. And then on top of that comes the fear and the psychological effect, and stress-induced cortisol release all reduce the body's ability to fight off the virus. And there's no thought being given to that. Certainly the media here in the UK is whipping up a storm every single day. And there's a lot of fear being created, which is just very negative to people's health and ability to fight this as well. I don't know if you're feeling the same in the States. Or do you feel it's
well, I mean,
justified?
You know, some people react differently. I get the information, I don't get fearful, I feel informed. And some people, they get fearful when they get the information. You know, I'm somebody who goes toward information. I want to know as much as possible in order to be as well prepared as possible. Some people, when they hear the numbers going up, more and more areas, we don't know about this, that makes them fearful, you know? Yeah. So there's a lot of individual response, but certainly in general, our medical systems, our mainstream medical systems in the United States and many countries, you know, do not look at nutrition as a factor.
No, they don't hear either.
You know, there is a strong bias against any type of supplement because it competes with pharmaceutical interests. Even though the supplements may be very well studied and proven to be effective. And certainly now some people have come out, psychiatrists and psychologists have come out and said, limit your exposure to the media if it's causing stress.
Oh, really? Okay, they haven't said that here yet.
They have said that here. They have said, limit your exposure to media if it's causing you stress, because they said it will increase your cortisol levels, it will suppress your immune system. There's been recommendations that they have had more, this is not just the last couple of weeks or last week or so, 2 weeks maybe. So they've talked about the psychological aspect of managing this. They've talked about how people have feelings about this and they should have places where they can express the feeling. There's been an increase of online Zoom and Skype services offered for psychiatrists, psychologists, and people to talk to.
Oh, wow. Okay.
Yeah, so they're trying to accommodate the psychological and emotional aspects of all of this uncertainty and fear that's being caused by this pandemic.
Okay, quite a few comments have come in relating to whether this is being spun to a certain extent by governments across the world to use this to take away our civil rights. This relates, of course, to the previous question I asked linking up to 9/11, which we know less about here, but is there a sense where you are, at least? I know that America is very big and one has to talk about it state by state, but are you getting a sense that people are worrying about that over there as well?
I'm going to take it even broader than that. So I've worked in parts of Africa that had Ebola outbreaks and hantavirus outbreaks. And in parts of Asia where they had typhoid and cholera outbreaks. And really the only public health response we've had until very recently has been quarantine. Remove yourself from possible contagion, stay in your home, do not go out, do not expose yourself to other people. That's basically the only technique or strategy we've had to be able to control these serious and highly infectious diseases. And we've done them, humanity has done this multiple times. Once they started to understand that certain things were carried by germs, they started to institute quarantines whenever there were major outbreaks of various illnesses, the plague, for example, too. Not during the time of the plague, but subsequently. There'd be a plague outbreak and people would go into quarantine and isolation. So some people feel that is a human rights, that's a violation of their civil liberties to force people into quarantine. But, it's also like one of the only things we've had so far to date to control major infectious disease outbreaks. So, but the other areas around it are, like you said, the tracking, the tracing, the drones coming in and telling you. I mean, I saw images of people in, I think South Korea, walking outside. They had no mask. A drone came up and said, "Put on your mask, go home and put on your mask." And the person scurried home and got their mask and put it on. Is that a violation of my civil liberty, of that person's civil liberties? Well, I mean, if it's protecting the lives of everyone that they may encounter, this is a hard question, right? I mean,
sorry, one other comment that's come in is related to that, of course, because you said the only advice we're really being given is to quarantine, that treatment or at least management should really be on an individual basis than a generalized protocol. In other words, certainly as far as the quarantining is concerned, surely there should be a lot more sort of granular thought put into who and how and when and so on to protect the economy going forward, as well as, of course, people's health.
Well, yes, yeah, and I think, I mean, from what I've been reading is that there are a lot of studies looking at different types of treatments, and there's been a major study looking at twins, both identical twins and fraternal twins, to try to determine the disease path. And right now there's a theory that there's two basic different disease paths that the average person can take. There may be an association with blood type. There may be, and of course, we know there's already associations with various comorbidities. So yes, all of these things require a more granular approach in terms of how you would treat one person who's getting the respiratory versus another one who seems to be getting the coagulability, stroke type issues. So yes, and I think we're kind of at the beginning of that in terms of understanding it. And I do think it will need to be quite personalized. I think it's going to be a challenge, to get all of these therapies up and running quickly, because this seems like a moving target in terms of learning more and more about it. But I think everything should be on the table. I'm very, very disappointed that there's been attacks against the use of hydroxychloroquine and azithromycin and zinc as a combination therapy. Yeah. And that, in my opinion, has a lot to do with pharmaceutical corruption, corrupting.
It goes so far, doesn't it? I mean, another person has posted that she feels freedom of speech is being infringed on because she's put several comments up that, were very similar to what you've said earlier, for example, about how appalling it was in the USA that they told them not to wear masks for quite a while, and her Facebook post was removed. And you're wondering who's controlling all of this and who's making the rules.
Well, I'm sure there's a number of different entities and individuals involved with controlling media flow and information flow. I'm sure there is.
Mm-hmm.
So it's not one individual or group orchestrating this. It's kind of like they have algorithms and they search for certain words, and if something comes up, then they tend to take it down, and they're justifying this by, you know, they don't want to spread panic and you know, more divisiveness or whatever. So again, you know, I mean, I've seen things posted that I consider to be completely fake information, and I respond by saying I think that's fake. Other people have responded to some of the things I've posted by saying that's not true. I'm like, okay, but it's out there, you know what I mean? Right now, I think as much information as can be shared is very, very important.
Yeah, very good information is being shared here as well about people's ideas on, or you know, what they have already accumulated, no doubt from good sources and from their training on what protocols they would recommend for prevention. But I think that's going too far into the medical area, where perhaps you know, we should address that at the time. There are a few comments like, where would our human rights stand if we have the vaccine?
I'm sorry, I didn't hear you. What?
Wish to have the vaccine, but the government advised or insisted that the only way to not be watched with a track and trace would be to have that. But
well, that's a very theoretical question. We're not there yet.
Exactly.
Yeah. And in fact, I mean, there's already discussion that because of this virus is so multifocal, it can go in so many different directions, and because it's already been documented that we have over 300 strains already, that it may be
mutating, isn't it?
Yeah,
so fast.
It may be that, you know, we don't even have to worry about the vaccine problem issue for quite some time. And it also may be that, you know, we're going to have to develop different types of vaccines for different types of people based on their genetics. I mean, if there's a clear correlation between a blood type and susceptibility, that might require one type of vaccine versus another, you know, and it may also be very much based on your immune function.
Yeah,
what kind of vaccine you can get. And of course, people with compromised immune systems who could not benefit from a vaccine because they can't make use of it, right?
They can't even make immunoglobulins, exactly.
Right, so, and then those people should get some kind of probably waiver that they don't have to take a vaccine. So, I mean, I think these are a lot of hypotheticals, and I'm glad people are asking them. I mean, myself, I believe that vaccines have a role, but I think it's very important that we have vaccine safety, number one.
Absolutely.
And that always understand the role, the pros and cons of any vaccine they take in terms of protecting their health or possibly risking health adverse outcomes. So
yes.
we have that.
Thank you. No, there are quite a few other questions that have come in that I haven't yet asked, so I will ask you them, and we'll possibly have you back on and go through those in a question and answer session, which would be lovely. Thank you. So the hour is almost up, so we probably shouldn't continue a lot longer than that, but thank you so much. That was a fascinating discussion. Huge knowledge and expertise you have to give us over here in England. Could I just mention that we will be continuing with these COVID-19 webinars, and we do have Dr. Horowitz, Richard Horowitz, already scheduled, and Dr. Robert Bransfield.
Great.
We'll be having Dr. Armin Schwarzbach back to do a Q&A with us based on the presentation he's already given. So, I mean, in one way, we really hope that this won't last for a lot longer, so that none of this is necessary. But on the other hand, it looks like it might. I mean, I already heard today that the Pope has cancelled his 2021 and 2022 events and postponed them to 2023. That's a little bit worrying there, what, you know, advance information he may have. But I mean, his gatherings are huge, so let's not worry too much about that. but I mean, we very much hope to have you back anyway. Let's put it that way, whether it's about COVID-19 or perhaps an update on the Lyme and the Lyme borreliosis work that you're doing. That's so huge as well. So thank you very, very much indeed.
Thank you. Thank you for the opportunity, Gillian, and thank you to your organization for having me here. And I hope that I was able to provide people some insights and also some understanding of how resilient and tenacious they are as survivors of chronic Lyme disease and tick-borne diseases.
Thank you very, very much indeed. And thank you everybody for being here. Bye-bye. Mm-hmm.
Bye.
Bye.